talk to about you is the people that you have said we can talk to.
Okay.
So you never have to worry that we're going to give your personal health information out. If Uncle Joe from Idaho called and he said, Sandy's in your hospice care, how's she doing? Well, if you haven't said he's a person I can talk to, I can't even say that I know him or that I know you. I can't even say you are in our care at all.
Who?
You know? Yeah, exactly.
So you need to, she needs to provide you a list,
And
because there will be a list.
okay, yeah, and if she
Not
decides to
everybody,
sign on
but-
with us today, then there's a section in here where she'll write down who she wants.
Okay.
Okay.
And is this? I've asked it already. Never mind. Yeah, it's the freedom.
Yeah.
I have to look at her thing to see. And I remember that woman the other day saying, you know, it's called freedom. So.
Yeah. You should expect that we give you the best quality care possible. I can tell you that there is not one member in our team that I think does a poor job or doesn't try to do the best job they can. We're all in this position because we love people and care about people.
That's what you want to do.
And yeah, I left this position briefly because I thought maybe there might be something else out there for me, but what I realized was I love hospice. I love taking care of people, and this is where my calling is. And I think pretty much everybody in our team feels the same way.
Mm-hmm.
So we will definitely try our best.
I tried to branch off too. I'm like, my heart's just in it. I can't do anything else.
Do you want this? I'm sitting here leaning on it, and I'm.
No, actually, I'm okay.
See, I can't just sit up like that.
As far as responsibility goes, there's a section in here about patient responsibilities. It looks like kind of lengthy. I probably should read it through at some point in time, but I can tell you the only one I'm really concerned about is just, as a nurse, just that I get your full health history and anything that's going on with you so I can do the best I can do for you. So if I come in and you're feeling really horrible, tell me you're feeling horrible. Tell me what's going on, because I can't fix something that I don't know is broken.
Right.
But,
I would. I
yeah.
mean, it's just because I'm to that point with the hurting and different stuff that, like when you called, you know, I was just like, well, you might as well now have Sandy just took that medicine. You know you're gonna, you know, not catch it all.
Mm-hmm.
And then they came in and I was like, oh, I'm so glad you're here too.
I'm sorry. So right now, how are you feeling about going on board with hospice? Do you feel like you have exhausted all the things you want to try, and you're ready for comfort care?
Yeah, I want to feel comfort. I don't want to hurt any more than I do now, and I know I'll hurt more.
Okay, because with hospice, that's what we would be focusing on. And to qualify for hospice, you have to be within 6 months, which your doctor said you are, and you have to be willing to accept just palliative care, because
What's that?
That's comfort care. Because to be on hospice, you cannot be actively pursuing curative care.
Okay, and from what her doctors have said, that's not in the future. You know, that this is pretty point blank what's going to happen.
Mm-hmm.
But now they have talked about doing a treatment that will relieve what's going on. Which,
No, the treatment will be little balls they
yeah.
put down in me, and it blocks where the blood's coming through on the
Right.
internally.
Okay, to stop the internal bleeding,
Do you want me to see if that's...
please. It's Jennifer. If you could take that, yeah, please.
Is that Joy?
Oh,
Or
no.
Jennifer?
Another nurse with us. She's tried calling me several times today, and I've been so busy I've not been able to answer.
But that's not curative.
She can still pursue any type of care for any other illness except for the hospice diagnosis.
Okay.
So
And that is very definite. Yeah.
Right. So if we take her on for liver cancer, then she cannot pursue aggressive treatment for liver cancer. But if she wants to pursue getting the internal bleeding taken care of, yes, she can. Anything else going on with you? You can.
Well,
see
that's the only
the
other
doctor
thing
for it.
was the bleeding
Right.
thing with that K90 or the Y90 was to get those little blocks, get those little where it was bleeding blocked,
Mm-hmm.
and he explained it like a car.
Mm-hmm.
It was funny, but it worked.
Well,
Explanation came through.
yeah.
But yeah, that's what I'm thinking. That I don't want to go through all that. My sister passed away from cancer, and she did treatments, and her and I had conversations a lot about it because she really believed in quantity
Versus quality.
Yeah, and I want quality. I don't care about. I don't want to live to be 190 and not know me at 61.
Yeah.
I want to be able to make some memories, and I'm not done yet, and I don't really think the plan is for me to be done, but I'll go along with it. I'm not gonna fight it to where I turn into a bitch or something like that.
But you want the rest of your life to be good.
Yeah,
Mm-hmm.
I want to be able to go out in the car. I want to be able to go buy something for my grandson for Christmas. I want to do some. I want to live until I'm gone, like anybody should. I think.
Mm-hmm. And for her to get out, to go to the fact of that you need that ramp to be able to go out. She has fallen multiple times.
And I can't promise a ramp, but what I can promise is that our social worker will try her best to try to find the resources for it.
Well, you can
before we had a church that stepped up. She contacted a church and they stepped up and did it. She looks, calls every place that she can call and tries to figure out where I can get help from. That's her job.
Right.
And she's really good at it.
Well, you can see
good.
Gage. I mean,
that's not
Gage.
Gage is not barking.
But you can see where my eye goes cross.
Mm-hmm.
Well, when I was born, I was cross-eyed, but I outgrew it all. Everything got better. And 2 years ago, I fell outside here and cracked the side of my head on the ledge of the front porch, and ever since then it just knocked it right back into I don't know, but it's like that. So sometimes I can control it, but it has to be brought to my attention. Excuse me.
Okay.
I'm just trying to say everything I know to say.
And you know what? I will actually, if you want to go ahead and start hospice today, we'll go ahead and sign the consents. I will do a full assessment. There'll be a lot of questions I'll ask because I want to know as much about your history as possible, just to give the doctor a good overall rounded picture of what's going on.
I would like to know if there's anything that I know there is, but I don't know what it's called or whatever. I'm gonna call it a lift. But that comes over the top of my bed where I can pull my body up.
She's talking about a trapeze. Yeah, they can do a trapeze.
Because see my bed, I mean, I can get in it. But then when I gotta have people scoot me over to the middle, and then if I gotta go to the restroom, then it's getting out of the bed. And I do have the potty chair in there. And
with the hospital bed, it might come right with it.
Yeah.
And unfortunately, if you're sleeping in here, we need to get this couch out of the way. I mean, this thing, and put your potty chair in there. And he's just going to have to say it's all clear before he comes through the room. You have to go to the bathroom for your own privacy.
Oh, me?
Yeah.
I'm done with that toilet for quite a while. Long as I've got a walker, and
So you might not need it for a while, but you might need it later.
Yeah.
I just need it to be able to walk with. Because like when I wake up and, you know, I'm drowsy or whatever, and I'm grabbing this to get me to the bathroom, and I forgot what I was going to say.
That's all right.
Yeah.
I think she gets
Yeah,
the
I
drift.
Do you have a chair for the shower?
I do, but I don't like it. It's solid.
Mm-hmm.
It's like round, and it's got a few holes in it, but that's all. I mean, there's no... How are you supposed to clean your behind when you're sitting on a solid, you know?
I don't know what. Those are the only kind of chairs I've ever.
Well, what I used when I came home was the potty chair, because the whole thing comes out of it except for the...
That's
We
my-
did that at the facility sometimes.
Yeah.
Yeah, the lid and the bottom of it.
It's actually a really good idea.
Yeah,
It
straight
is.
shot, everything's clean.
We want you clean.
I do too.
But we will, you know, be
I
bringing
love
home
your
health
ring.
aid
That
in.
is just
Oh, thank you.
gorgeous.
Yeah. Thank you. We will be bringing a home health aid in though, and they can help you get cleaned, you know, a few times a week. So that'll be a little bit of help too.
Yeah, it'll be some help.
Yeah.
Because I did learn to throw away my modesty at the hospital.
You do learn that at the hospital, don't
If
you?
you got it when you go in, you're not going to have it when you come out.
Right. Right. Okay, so if you want to go ahead and start hospice today, we'll sign the paperwork, and then I'll just do a complete physical assessment. We'll talk about everything that's going on with you as far as health history goes, and we'll talk about, you know, whether or not you want to visit from the pastor, the social worker, you know, and what your needs are at this present time as far as equipment. And I'll make sure that my medication list matches what you're taking right now. So that when I go back to the office and I enter your meds in and get the clearance for what we cover, I've got the right things, and that you're going to be getting the right things delivered to you.
Yeah. And that one, I don't know the real name of it because I can't remember it. So whenever he gives me, like he gave me those three, he said just make it easy on yourself and Xanadu. Like
Xanax?
No. A Xanadine or...
There's one that's olanzapine, but and it is actually the generic of Flexerol.
No.
Just
Okay.
ask him. Send him a text and ask him, so you can tell her before she leaves. Is he at work? Don't chase shiny objects.
No kidding.
It's easy to do.
I wish they wouldn't staple these.
Yeah, I think somebody did that.
They
on
need to
accident.
stop stapling this. There's just too many papers to go through.
I'm gonna need your phone.
And come on.
My phone's about dead.
Well, Monica wouldn't know then. She's trying to help. That's good.
Hey. What are you doing? You need to tell me the name of that muscle relaxer. Tizanidine? Tizanidine. Okay.
I'm not familiar with that one, but it's probably all those medications have like 4 or 5 different names they go by.
No?
They all end in the same thing, but they all begin with something different, I know. Depends on if it's
Yeah, they are.
generic or...
And which companies?
Yeah,
making it.
I couldn't
Yeah.
remember the name of that. Tizanidine. Alrighty. Okay.
4 milligrams?
4 milligrams. Okay, well, I'll give you a call after, yeah. Jane and Mike are here.
Flex. Is a brand.
Yeah.
Okay.
I know, they got here about 10 minutes
It's probably
before
in
they